you're not blowing out.
But that's a COPD problem.
That's a COPD
not
problem.
pulmonary
Getting,
fibrosis.
yeah, releasing the carbon dioxide.
Yeah. And you're a nurse, right?
No.
Oh, I thought I heard you say that. Well, it's true.
But your lungs are being damaged enough where the CO2 is not being
Yeah,
exhaled out.
and that can be from a variety of reasons.
Yeah.
It can be from the COPD, it can be from acidosis. It can cause a lot, but the key is knowing what you're dealing with. In case of weaning, if you rush people on that, then you'll have a lot of failure. So it takes a long, long time. And not everybody can be weaned on that. Some hospitals like ours won't take patients if that's too big a problem. We try to take all the patients and try to give everybody a shot. The second lady, now this is my favorite lady of all time. This lady was 92 years old in Mexico when this picture was taken. She's the lady of parasailing. Anybody know what parasailing is?
Wow.
She lived up in Irvington and was at Rappahannock General Hospital. You know, that little hospital?
Yes.
And when she came back, I get an email from her granddaughter who lives in Mexico and sells yachts. I get the family email every December. And her grandmother always wanted to go parasailing, so at 92 she did it. She came back home, and they were taking some trees down on the property, and just at the last minute when they were cutting some trees, she stepped into the trees to give one last command to the people who were cutting them, and the tree came down and hit her. And it fractured her shoulder and put a rib through her lung, and it fractured, really horribly fractured her left ankle. When we saw her in the hospital, they said, it happened to be the first day I ever visited that hospital. And they saw her there and they said, well, it's got a 6-bed ICU in that hospital. And there was one patient, they said, we don't think she's going to live. We don't know what to do. And they said, well, why don't you give us a chance? Well, we did. She stayed with us about 8 weeks, 7 or 8 weeks. We got her off the ventilator. We gave her some rehab. We wanted her to go to a rehab hospital, but she refused. She's headstrong. She wanted to go home. She went home with home health. So we got her home. So that's one of my just all-time favorite stories. This other lady here, amazing lady. This lady is the picture of gets the most health care in the state of Virginia for that year. This was our first patient. So every doctor, every nurse, every respiratory therapist for about 3 days had nothing but one patient. And she was a delight. She also came from Chippenham. This is a picture of her after she was taken off the vent. You really can't see it there, but she has a patch over her where they removed her trach. She has a nasal cannula in that hose. She had a peg tube, we pulled the peg tube, and she was a talker. So we got her, first we got her in a cap so she could speak, and when she got her off, she was just a delight. And we got her, that's her son, James. We got her out to a nursing facility because she couldn't go home. She didn't qualify for rehab hospital because she couldn't handle 3 hours a day of rehab. So she could only qualify for that skilled nursing facility. So she was there for 3 weeks and went home. Did very well. A year later, we were having an open house, and we called and invited her to the open house. She just passed away about a year later. But her son James said that he wanted to come and not just attend, but speak at our open house. And the day came, and James didn't show up, which was very unusual. This man, if you knew him, you know he did everything he said he was going to do. 2 weeks later, he came. He said a drunk driver hit him and his daughter in his car, and he turned over the car on the way to speak. And he came in and apologized for being hit by a drunk driver. That's the name. But he's always been in our minds ever since then. If you ever come to see our hospital, we've got this picture up in our hallway. So this is our very first picture. So that's the end of the organized, if you will, the organized part of the presentation. Anybody want to do some disorganized part of the presentation? We were talking about healthcare reform. Anybody understand healthcare reform? You do? All right.
Real simple question before you get that. What is your location?
Duh, that's probably I should have said that first.
You may have,
No, I didn't. We're on Edward Holland Drive, which is right off Bethlehem Road, which is close to the corner of Staples Mill and Bethlehem. If you get off 64 on Staples Mill site, going towards Broad Street, you have to, close your eyes and cross over 3 lanes of traffic to get into the first stoplight. Take that left, first right, then first right into our parking lot.
You have an address?
Yes, it should be on there.
No, I don't
It's on my card.
Anybody that knows Richmond well, it's behind the old Owens and Miles.
I'm not in Richmond.
It's 20/20 Edward Holland Drive.
Oh, yeah, it's on here, it's on the card. I'm trying to check the card.
Anybody else?
No, I just, I just wanted to know where I was.
We,
No. No, I just wanted to go by and see it. I mean,
we got a cheat sheet over there.
oh, no,
And there's the website on the card has a virtual tour.
It's a really pretty facility.
And
Russell and I remember.
That's
what you did.
And I will say that the entire staff look like they all just love their job. I mean, it's just a beautiful facility, really beautiful.
it's how many beds?
We have a 60-bed facility, but we cap at 48 patients because of our medical team. We don't want to go over that right now.
So patient to nurse ratio?
Patient to nurse ratio, our patients are about 5-to-1 on days, 6-to-1 on night. But we have a completely different nursing model than a short-term hospital. I was talking to you a little bit about the specialized teams. We have one respiratory therapist for every 12 patients. So the respiratory therapists do almost all the suction, which is usually a nursing function. They do most all the oral care, toothbrushing things, which is usually a nursing function. We have wound teams. We have a 4-nurse wound team. So all the body checks for wounds and all the wound care, which is usually bedside nurses function, is done by, not all, 95% is done by the wound group, which is a surgeon that leads that, a really good surgeon, a trauma-trained surgeon that leads that wound team. And then, of course, we have our PTH speech. We have a lot of assistance and coordination with moving patients and trying to organize people's therapy before they get dialysis or get too winded to be able to do it. So we got a lot of people that help out. So the nursing teams usually have 5 patients, a nurse, 5 patients, a nurse, and 1 aide that helps for 10 patients rather than 1 aide for 20 patients. So it's quite a different model. But, and our patients being longer stay patients, we get very seriously ill, but most people know what we've done. The short-term hospitals have rescued, set up the treatment plan, done all that. So the short-term hospitals usually, by the time we hand off, we know 90% of what's going on. It's always possible for patients to have other problems come up. We're, of course, a hospital, so we can deal with most of those. Somebody needed a surgical intervention or they had a heart attack, we can stabilize that, get the patients to a short-term hospital to assess it. Then they come back to us if it's within 3 days. That's something that actually that hospital just sends us a bill. So that's an extension of us if we ever have to do that. That's me.
Do they have private rooms or is it a combination of shared rooms and private rooms?
That was one of the probably, there are 2 things I wish we'd have done when we opened up. They're all private rooms and we'd had more ICU rooms. We only have 6 ICU rooms. It's a high observation. But we have semi-private and private. They're huge rooms. The good news is most patients are by themselves in the rooms because we have 60 beds and we only take 48 patients. There's no extra charge when that happens. because we get patients from other hospitals, we reserve the right to move patients for their well-being, because very often we see patients that might come from Winchester Hospital or Fauquier Hospital or Georgetown or down in Duke, and they come to us and they say, oh, there's no infections, or there's this one infection. We find out if we check everybody on admission that there's another one. So we have to be able to move people for their own health and safety. But we do have some semi-privates. If you went and did a tour, you might see 2 or 3 rooms with 2 people in it, one of which may be a request, because there's some people that do social.
Who recommends that you go to this hospital? The doctor, the hospital?
Typically what happens is the case manager, the doctor recommends it, but the families can request it.
Yeah, that's what I asked.
And we get a lot of family requests, because a lot of, especially hospitalists, they change so often, they just don't know what's going on. We can't keep ahead of it. We do education, I do maybe 3 or 4 physician educations a week for the last 6 years, and I still can't keep ahead of it.
What was it the other night on the news? Now you're supposed to, when you get sick or well, or whatever, you're supposed to go through and like a can of beans, you know, that's got this many carbohydrates. Go through and check the different hospitals, the rates and all. You don't have time to do all that.
Yeah, most people depend on their doctors for that. And if the doctors are fully aware and care, then you're okay.
What did you mention about Health South earlier? And what,
Well, Health South has a pulmonary rehab program.
yeah, Sally Gannon.
Sally's a good friend. I used to work.
I love Sally.
Sally's a good friend. So, anybody else? I saw another hand. Was it Russell? Russell.
I don't want to step on toes, but if a physician didn't believe in your program,
Right.
and sent a person on to hospice that may have gone through your program and come in it. And it's gotta happen.
It has happened.
That's the reason I asked.
People don't need to go to
The
hospital.
lady that I told
You
you
get the old
about,
morphine and lorazepam treatment.
Ms. Rothsky, the lady in the middle, you know, they didn't know, so they were going to let her slip.
Yeah, exactly.
And, you know, that wasn't malicious, it was a lack of knowledge. And if a doctor just doesn't believe in us and wants the patients to go to hospice and knows about us, I think that's a problem, because people should fully, everybody seen the patient rights, the Bill of Rights?
Yeah.
Every hospital has a patient's Bill of Rights. And you have a right to be fully informed about your treatment options. That is a right under regulation. And you have a right, the doctor may not agree. It's a free evaluation, whether you're talking about LTAC or rehab or even a psychiatric evaluation.
Well, that's a lot of